Hello, and welcome to this short clinical refresher about Canine Cognitive Dysfunction Syndrome, as part of the Make Senior Easier material. Let's start with what Cognitive Dysfunction Syndrome is. Dogs with CDS experience neurodegenerative changes as they age, which affects their behaviour, a kind of doggy dementia. You can see from the stats shown that it becomes increasingly common as dogs get older. The fact that so few owners even think to mention it to their vet, however, reflects that many owners just see the changes as a normal part of aging. The pathogenesis of CDS is not fully understood and can be variable between individuals, but common pathological processes include a reduction in the blood flow to the brain and the accumulation of free radicals, which have a potentially damaging oxidative effect on brain cells. As diagnosis of CDS is made primarily on the resultant behavioural changes, the diagnostic process relies heavily on the owner, as dogs often simply don't show the signs in the consult room. There are many ways that owners will relay the changes that they're witnessing in their pet at home, but it takes a good ear to pick out the key phrases. One way to help categorise these behavioural changes clinically, though, is by using the DISHA acronym. Disorientation can include getting lost in the house, difficulty negotiating obstacles, or staring at walls. Interaction changes can apply to the owner or to other pets. Irritability, new fears, or increased clinginess are common. Another one is forgetting how to respond to commands. Restlessness or even barking and pacing at night is another common sign. And dogs can start sleeping more in the day with or without these nocturnal changes. Loss of house training skills or forgetting to signal that they want to go out and other changes to toilet habits are one of the changes that many owners struggle the most with. Some dogs with CDS will start aimlessly wandering about, while others seem constantly restless or frantic. And others go to the other end of the scale entirely and exhibit total apathy. Of course, many of these changes could be due to other medical conditions, so it's really important to rule these out before making a firm CDS diagnosis. It will obviously depend on the specifics of each case, but almost all body systems can be implicated, so a comprehensive clinical exam and appropriate diagnostic tests will be needed. Once a diagnosis for CDS has been established, there are three main pillars of management, with the ultimate aim of hopefully slowing further decline, but perhaps more importantly, achieving improvement in the quality of life of the dog, but also their owner. This condition can be really distressing for owners and quite scary to face, so acknowledging that is a great first step. Owners need to understand that the condition is progressive with no cure, but you can reassure them that you will be with them every step of the way to advise and assist. One of the most important things that owners can do is maintain consistency at home. Whether it's daily routines, locations, or avoiding surprises, it all helps their dog manage day-to-day life more easily. There are medications that can help in some cases. As we said at the start, the pathogenesis is variable between individuals, but many cases see successful improvement of clinical signs following the introduction of drugs that improve cerebral blood flow. Behavioural modification drugs can help with dogs that are becoming anxious as a result of their cognitive changes. And specific drug choices here will depend on which of the behavioural changes are most problematic in each individual case. Vitaphylline is licensed to improve both blood flow and overall demeanour in dogs. Its body-wide effects means that it can be effective at improving many circulatory issues that are more common in old age. This short CPD is part of a whole suite of materials designed to make senior easier for older pets. Visit the pack for the full range.